whenever there is a hyperactivity of adrenal cortex, it is going to lead a group of symptoms which is called as Cushing syndrome. Obviously, it occurs because of the hypersecretion of glucocorticoids, and there will be increased in the glucocorticoids secretion accompanied by increase in the secretion of adrenal androgens. Some of the causes for Cushing syndrome are adenomas of the anterior pituitary that secretes excess ACTH, and abnormal functions of hypothalamus that causes high levels of corticotropin releasing hormones, and ectopic secretion of ACTH by tumor elsewhere in the body. They are also caused by adenomas of the adrenal cortex. Cushing syndrome is Cushing syndrome due to the anterior pituitary is called as Cushing's disease. That is Cushing's disease. The etiology is here. There is a tumor in the anterior pituitary. Signs and symptoms of Cushing's syndrome. There will be disproportionate distribution of the body fat producing following features. There will be moon face due to the accumulation of the fat in the face. There will be buffalo hump due to the fat accumulation in the upper back. There is a pot belly due to the fat accumulation in the upper abdomen. Purple striae are seen, which are reddish purple stripes on abdomen due to the stretching of the abdominal wall by increased subcutaneous fat, and it also due to the deficiency of collagen fibers due to the protein depletion, which causes thinning of the skin, and this also occurs because of the rupture of subdermal tissues due to the stretching. Other features are there will be thinning of extremities, the muscle are poorly developed due to the protein catabolism, facial hair growth, and there can be presence of acne because of the effect of androgens. The wound heal poorly, and minor injuries causes bruises and ecchymosis. There will be hyperglycemia due to the gluconeogenesis. There will be increased bone resorption, which causes osteoporosis. There can be mental abnormalities, and there can be blackening of the skin due to the pigmentation of the skin by melanin stimulating hormone like activity of the ACTH. And it is associated with hypertension due to the increase in the retention of sodium and water. So this is the typical clinical feature of Cushing syndrome. You can see the red cheeks, moon face, bruisability and ecchymosis, thin skin, poor muscle development, and there can be poor wound healing, pendulous abdomen and purple striae, and fat packs over the neck. The treatment of Cushing syndrome is the removal of the adrenal tumor, and tumors in the pituitary gland that oversecrete ACTH can be surgically removed or destroyed by radiation. Then there can be serotonin agonist and GABA transaminase inhibitors, which can inhibit ACTH secretion, can also be utilized. And ultimately, the bilateral adrenalectomy if ACTH secretion cannot be decreased.